when you feel so much better in many ways, you're still concerned about certain things, a certain lack of, did you call it initiative, or the ability to push yourself ahead or make plans, or what is it really now that keeps you going to the doctor and keeps you taking medicine?
Well, of course, I keep taking the medicine because I don't want to go back into depression again. That's definite. I'll keep taking that medicine for the rest of my life, as far as
to
I'm
protect you
concerned.
against it. But would you say you're perfectly well as long as you're taking it, or is there still something underneath?
Oh, yes, there's still something underneath. I'm not...
What is there?
That's hard to describe. I would say, see, I'm just not happy.
Mm-hmm.
Now, it's hard for me to say just what happiness is, too, because that's difficult to describe.
But looking at other people and comparing yourself with them...
What I see and what I see how they enjoy things, how they enjoy other people's company, and so on. That's what I'm after. I'm trying to get the same thing in life that I think other people get.
Mm-hmm.
Same things that I like.
And you are not getting it yet,
No.
you feel? Well, I think you're on the way to...
I have a feeling that we ought to cut, gentlemen.
Well,
Do it again, Bob. Yes, Jones. Got it?
good.
13 and 12.
You were telling me a few minutes ago that you found it so difficult when people, even doctors, wouldn't believe you that you were depressed, and yet you felt so awful inwardly and you didn't seem to look depressed.
Yes, well, what made me feel so badly was that I felt that I wasn't being a man, that I wasn't standing up to this sickness like other people did. That is, I was making a big fuss over something very small.
Well, were you?
Well, not in my mind I wasn't. I thought I was feeling horrible.
Well, if you thought so, you must have felt horrible. Well, did anyone else imply or say that you were making a big fuss about?
Well, many people told me there's nothing wrong with me.
Why would they say that?
Well, possibly they just wanted to make me feel better. They didn't want to tell me I looked terrible or that there was something wrong with me.
I understand that you never really looked very depressed. For instance, you were always known as the smiling one and one who would joke and make others feel.
Yes, that is strange, although I'm certain that when I was severely depressed, I wasn't smiling as much as I did prior to it.
Were you smiling at all?
When I was depressed? Oh, yes, because the evenings, for instance, I'd go into, as I mentioned before, I'd go into a sort of a daze, and then I could almost forget
Mm-hmm.
that tomorrow morning hell was going to break loose again.
Mm-hmm. This is a good deal better now because you're taking treatment, certain medicine, but would you say you're completely all right?
No, I wouldn't say that.
In what way are things
Well,
still
I
wrong?
think I could feel better than I do. That is, I could feel a little more cheerful than I do. And apart from that, of course, there is my association with people is not as good as it might be. I'm sure of that. I don't have many friends, and I've never been able to get married. I've never been able to care for any girl enough to marry her. And I never been able to study or improve myself in my position.
Why not?
Well, I tried on a couple of occasions prior to the times these depressive spells began.
Mm-hmm.
I tried on occasions to study, and I seemed to get to a point. I tried cramming. I tried too hard. I was always trying to be better than the next guy. I wanted to be first in the class and so on. And I just blew up suddenly. I couldn't study anymore. My mind would I just throw in the sponge, in other words.
What happened then?
Well, I felt quite badly after that. After a thing like that would happen, I feel very badly. But that depression, as I know it, did not even strike then. I did not go depressed until I became severely anxious over something.
Mm-hmm.
I became severely anxious. The state turned me into a depressive, which I've been ever since.
And that is how long now?
That was over 10 years ago.
And at that time, you went to a psychiatric hospital and you got some electrical treatments?
Yes.
Several times.
Yes.
And you also were thinking, you told me before, quite frequently of at the time.
Yes, there was a terrible fear of it. I was thinking all of the time, except in the evenings when the depression would not be so severe, or at least when I'd go into those days I mentioned.
Mm-hmm.
But I thought all the time, and it was the fear of it was not all the time.
That isn't the case now.
No, no.
Does it ever occur to you?
No, not, no, I can't say it does occur to me. Not anything like that. I am afraid that if I had nothing to do, that if I had too much time in my hands, for instance, if I weren't working,
Mm-hmm.
and had a lot of time in my hands, it might recur, the thoughts of,
Mm-hmm.
but as long as I have this medicine that I've been taking, at least I think that I wouldn't have the fear I had.
Mm-hmm.
People who know me at work find I'm very, very quiet. I don't speak to people unless I absolutely have to, until I know them real well.
Mm-hmm.
I mean, for instance, I'm working in a certain place and there are people who I see every day who walk right by me. I don't even know their names yet. The people who I've known them for a year. And I speak to them, I have to do business with them. I don't even know their names. And never bother to try to find out their names. And they must think that I'm either a snob or there's something wrong with me. I can't complain.
So
about
that
it.
doesn't trouble you. What troubles you most now, if anything, is this, what you called before, the emptiness of your life.
Yes, it's the emptiness of my life.
How would you describe this emptiness?
Well, I don't know just how I'd put that into words, how I'd describe it. I mean, I feel that most people are looking forward to something, that they have hopes. I believe we live on hope.
Mm-hmm.
And if we didn't have any hope, why, there'd be nothing to live for.
That's right.
Well, I can't see too much hope for me bettering my life.
Why not?
Well, I've been trying now for 10 years with psychiatric treatment, that is through psychotherapy, and I haven't noticed any improvement as far as my relationship with people is concerned.
Yet you have a fairly good position right now.
Well, yes, it's a living.
Mm-hmm.
Right, a living.
And with medicine and psychiatric treatment in the last few months, you have noticed a definite improvement, haven't you?
Well, I must say that there is no, as I mentioned before, there isn't the depression I knew before. This medicine has helped me a lot, but as far as my association with people is concerned, I don't notice any improvement in that. Of course, that was a problem before I ever had a depression.
That's right. And the emptiness and the feeling that there's nothing to look forward to, was that a problem too, or did this occur with the depression?
That started with the depression.
I see. That is still a problem now, isn't it?
Yes, up to a point. See, prior to my first depressive spell, I was quite young, and I was under 30.
Mm-hmm.
And I don't think anybody at that age is worrying too much about, well, what is he going to do in his retirement years
Mm-hmm.
if he has no mate and no friends and so on. A fellow of 25, 30 doesn't think of that.
No.
But I am reaching an age now where I'm starting to think of that. Well, in 25 years, if I'm still alive, I'm going to be on my own and alone, and I'll have nothing.
Why do you continue to see the doctor then? You see the doctor now.
Well, there must be back in my mind, there must be a glimmer of hope somewhere, and maybe I just don't want to throw it all over. I mean, psychiatry must have something. I mean, after all, It's recommended by people who know a lot more about it than I do, for sure. So,
Yes.
I take that, and I say, well, suppose I don't, I can't agree that there has been any improvement in my association with people. But if there is one chance in a million, I'm certainly going to keep on seeing my doctor.